Good morning, Facebook friends. It is Friday. We love Friday because obviously, for many of us, it's the end of the work week. I know for some of us, it's actually the start of a work week, of a weekend work for sure. But for many of us, it's the end of the work week. And but for us, it's the end of a wonderful week of YWTVs. And it is a great end to the week because we've got a great guest. I am Helen Arcanto. I'm the CEO of the YWCA of Northern New Jersey. My pronouns are she, her, hers, and I am so happy to have this time with you today. And I'm even more elated to have our guest because I am a true fangirl of our guest today. And this is such a tremendous opportunity, not only to talk to an amazing, fellow leader, in our community, but also someone who's doing such important work that we, have been talking about for years. We were just talking about it yesterday on YWTV, but it is so important and so urgent that we need to keep talking about it. So I'm so glad that we have a true expert in the field, to be able to talk about it more. And so with that, I am so honored to have Mariekarl Vilceus-Talty with us.
Yeah.
Talty.
Mm-hmm.
I got it. She is the president and chief executive officer of the Partnership for Maternal and Child Health of Northern New Jersey. And she is just a powerhouse in the state doing such important work. If you did not know, since the 1990s, the maternal mortality rate in the United States has increased. And no one has had more of a negative impact with that statistic than Black women. Due to healthcare disparities and implicit bias, Black women are up to 7 times more likely to die during childbirth than white women are. And again, we've talked about this, but it's important to keep talking about it because this is such an urgent and devastating statistic. And unfortunately, New Jersey is one of the leads in this statistic in the country. And, there's a lot happening in New Jersey to try to focus on changing that. And that's some of what we'll talk about today. Licensed by the New Jersey Department of Health and Senior Services, the partnership serves as the lead planning agency for maternal and child health services in Northern New Jersey. They work hard daily so that they can provide all women access to safe births using best clinical practices. And with all of that, we want children to be able to maximize their potential to grow, learn, and thrive through the support of a healthy family and the community. And when I say children, I mean all children, right?
Absolutely.
Not just a segment of children. Race, we want to get to a point where race and ethnicity will no longer be contributing factors in healthcare access and healthcare outcomes, which again, unfortunately, here in New Jersey, we still, are dealing with that. But before we jump in, I want to tell you more about Mariekarl. She has joined this wonderful organization as president and CEO in February of 2021. So, look at the calendar, folks. In a short time, she has made a huge impact in this work. She previously served on their board of trustees, so she obviously had a commitment and a passion to this work. And while there as the education committee chair, she directed the organization's professional and community education objectives. She is also a seasoned healthcare professional on her own with over 20 years of direct nursing and leadership experience. She began her nursing career working in labor and delivery at Queens Hospital Center in Queens, New York, and she quickly rose to supervisory positions. Most recently, she served as a senior director of nursing and patient experience at Jersey City Medical Center, RWJ Barnabas Health. She oversaw a team of 700 employees and focused on patient safety and improving care. She received her master's in nursing as a nursing executive. Nurse executive? As a nurse executive. Is that the right?
Yeah.
Okay, say it. From Columbia University. And she has a BS in nursing from Adelphi University. She is passionate about improving maternal health outcomes with a strong emphasis on improving health equity, advancing social justice, and preventing human trafficking. Folks, you can see where the crossover here in terms of our passions are for sure. I guarantee. She has been recognized for her stellar work in maternal health and commitment to excellence numerous times, including several March of Dimes Nurse Leader of the Year nominations, recipient of the March of Dimes 2010 Maternal Health Award for Clinical Excellence, the 2017 Leadership in Simulation Award, the 2015 Jersey City Medical Center Nurse Excellence Award as a transformational leader. And let me just tell you all what kind of lady we have here. And we've got a photo to show you. I recently had the opportunity to speak at an event with Diane von Furstenberg, and this lady just showed up, didn't even tell me she was coming, just showed up to be there to support me and to be there part of the event. And that's the kind of queen that she is. And I just want to call that out because we always talk about having a circle around you that lifts each other up. And although, you know, I have to say we haven't spent a significant amount of time together, we really just clicked immediately. And I think, you know that we can always just reach out to each other, you know, and we would pop in and be there. So, and we both cleaned up pretty nice that night, I have to say. And,
we sure did.
And look how nice we matched. So thanks for showing that photo. Thanks for showing that photo. You know, I feel like we have to get mileage of those really fancy moment photos because usually I'm not that dressed up.
Great minds think alike.
Yes. But you know, that I really wanted to call it out because I think not only everything professionally that we know about you, but at the core of who you are, you know, is really the, you know, that kind of woman leader that we talk about as being, you know, having her hand out, you know, for others and linking arms, you know, side by side with all. And honestly, that's what we all need to be at this time because we are definitely in a women's healthcare crisis in this country. Daily, we have decisions being rolled back. You know, we have, you know, policies being created that really put women at risk and more specifically, you know, women of color for sure. So with that, let's jump in. So let's talk about the work that, you know, your organization is doing and that you yourself have really had a whole career, you know, being committed to. Let's talk about some of the, you know, ongoing healthcare disparities that we've been seeing in our under-resourced communities.
Mm-hmm. It's terrible. But first, I would like to say thank you so much, Helen. I'm so excited to be here speaking with you. When I started in February, I think we spoke in like March, very, very early on. And immediately I felt that kismic attraction and we linked arms. And yeah, we've only seen each other once, but it's like we've known each other for forever. And you understand my New York accent. So it's pretty cool. It's pretty cool. But the Partnership for Maternal and Child Health of Northern New Jersey, which is such a long name, so we kind of shorten it when we talk, we just say the partnership, is part of the groundswell of change that is happening. We have been working with changing the paradigm for about 30 years. And I think that we are the best kept secret of Northern New Jersey. We're one of 3 consortia in the state, a 501c3 nonprofit that are licensed to help change the paradigm to what's happening in women's health. Specifically, the partnership covers the 8 counties in the north. Mm-hmm. So we cover from Sussex to Union. So you know that we have 4 of the largest cities, most diverse cities within New Jersey. So under our purview, we have about 50,000 births, 50,000 lives, 50,000 families that we empower every day to support them to live their best lives. And it's really about advocating for them. We have maybe 30 some odd professional outreach programs that we have for our constituents. And it's really about providing support through pregnancy for new moms, for fathers. I know it always says maternal child, but fathers are always such an important part of the family, mm-hmm. right? So through the work that we do with the Department of Health, specifically First Lady Tammy Murphy with Nurture New Jersey, we're starting to change those paradigms, right? We know that the statistics are absolutely disgusting. They are abhorrent. How can I, as an educated Black woman, go to the hospital and be 7 times more likely to die than my white counterpart. It just doesn't make any sense. And
Mm-hmm.
then my child, my little precious Black baby that I care so deeply for, is 3 times more likely to not see their first birthday. And also, why is it that I, as a Black woman, would be 3 times more likely to suffer a stillbirth or miscarriage? This doesn't make any sense. And we know what those issues are:
Mm-hmm.
systemic racism,
Yes.
bias. There's so many issues that we have to look at down the road, right? That are being worked on. So we at the partnership are saying, well, what impact can we have? It's about education, providing the support for pregnancy, providing the outlet, the referrals through Connecting NJ. So we want to make sure that top of mind, if anyone in Northern New Jersey, or if you're not from Northern New Jersey and you have an issue with maternity, pregnancy, you have questions about your pregnancy, about how to raise your child, what's happening with your significant other, if you're feeling depressed in any way, shape, or form, get in touch with us. We are the resource. We are the subject matter expert. And if we don't provide that service, so you don't live in Northern New Jersey, we'll get in touch with the other two consortia, because we want to make sure that we give you the education that you need to prevent any kind of prematurity, to talk about your comorbidities, if you have diabetes, to talk about, okay, you're feeling a little depressed. That's normal. We have a group for that. We have a support group. Last year in 2020, our emotional support line provided, I believe, 5,500 individual referrals for
Wow.
people who had delivered, that had mental issues or were just not feeling quite right. And you can imagine having a baby and then being home with the pandemic, being alone, not knowing what to do, not wanting to pick up your baby. You feel, despondent. Who do you call? Is it just you? Am I the only person? 5,500 individual referrals. And then the year after, 6,500. So people were reaching out desperate for information. What do I do? Who can help me? Is there somebody out there? So in addition to those programs, we of course provide empowerment to the communities. It's all about education. We have to start very early. Immunization education, lead prevention education, parenting skills, which is so important, right? You don't know what you don't know. I am sure that we can have stories the way that we grew up and what was
Mm-hmm.
expected of us, and how the children now are being, with TikTok and social media, things are completely different. We need education. We need to be able to ask questions. And we also have family success centers. We have one in Irvington and we have one in Dover that provides safe havens for families. We provide parent child activities, health education, citizenship classes, employment readiness, just practical skills and resources that people need, regardless if you were born here or not. As you know, my parents were Haitian, came here from
Mm-hmm.
Haiti. My father was an engineer in the 60s. He was not going to be working as an engineer, right? Worked as a
Mm-hmm.
housekeeper, worked as a cab driver. My mother she went to Jamaica, came to New York. She was a nurse, which is why I'm a nurse. Um, it was challenging. So imagine coming or being in this country at this particular time where people are not as welcoming. People are afraid. They're afraid to, go to the physician. Is ICE going to come? Is it going to be an immigration problem?
Mm-hmm.
Can I tell them what's happening? So we provide care, we provide support, we provide referrals in your language. Within our organization, we have such diverse people that work there from the community, which is really important. You want to be able to go somewhere where you see somebody that looks like you,
Looks like.
knows your language, understands where you're coming from, right? That's so important to be seen. So we make
Mm-hmm.
sure that we see everyone, that we reach out to everyone. We work with our hospitals to ensure that their constituents are educated, that they are their healthiest and most educated before the episodic care of going to the hospital. And then once they leave, we work with the hospitals to ensure care coordination. So when you leave the hospital, you know what to do. If you're feeling sad, depressed, you have an infection, who do you call? So not only do we educate the consumers, we also educate the clinicians. who want to do their best, right? I was a nurse. I worked in the hospital for 30 years. And I know every day I went to work and said, who am I going to meet today? Because, working in labor and delivery, it's such an intimate part of somebody's life. I remember meeting a patient years later. She remembered me because of my name. And, she's like, are you Mariekarl? And I said, yes. She's like, you delivered my baby. And I'm like, oh my goodness. Of course, I didn't deliver the baby as a nurse, but I was there.
Right.
She's like, you were so kind and you were so sweet to me. And one of the things she said is that you really listened to me, which is one of the issues that we're having now with the disparate care. When you look at the evidence, Black and brown women are not being listened to, right? When I say I'm in pain, the historical, generational bias that is embedded, unfortunately, into our society says Black women don't really feel pain. She's good. She's okay.
Right.
How do we change that? At the partnership, we're working with the Department of Health to help with implicit bias training, but it can't stop there, right? We have to know that there's support out there. So we have implicit bias training, we have education, we have the empowerment of the communities, and we have the advocacy that we're doing, working with Assemblywoman Spate that I know that you had on yesterday, working with Senator Ruiz, to move these initiatives along. Specifically, one great initiative that I'd like to talk about is the doula program. We have a doula project in Patterson, a pilot project working with St. Joe's, and they just completed their training of 20 doulas specifically for the Patterson community, which is so exciting because it's such a diverse community. And we know the evidence shows when you have a doula at your birth or a community doula working with you, they empower you, they advocate for you, they teach you how to advocate for yourself. Because you can imagine being in that vulnerable position and seeing the doctor. Are they saying this is right? Can I question them? Are they going to be upset with me? And the doula says, no, you can. Let's talk about it. We talked about what your birth vision wanted, what you wanted as your birth vision. Let's talk to the doctor. Let's get on the same page. So being able to really see that come to fruition and being able to start having doulas in the community to support the community. And with Assemblywoman Spate help and Senator Ruiz, we'll be expanding that doula program into Essex.
Amazing.
Absolutely. It is just so exciting that the people in Essex County will be able to get the support that they need. I know I've been going on and on, but I just love everything that we do.
Well, I first of all love your enthusiasm because obviously that's needed, to have that type of, really, focus and passion about this work because it is so urgent. And obviously you shared so much there and so many important pieces. So let me just shout out a few things for our viewers just to bring us back. One is we have on the screen here your website and that your Instagram page. We do encourage everyone to go check out all of the services. You can look at them and read them at your leisure and look at them in detail and see if there's something there that you or someone in your circle that you can refer to can utilize this program. And also, whether or not you are one that might use the services, I encourage you to follow on Instagram, because this is one of those conversations and one of those topics that, especially as a woman, you should be concerned about. You should be concerned about the disparities that we just heard about. You should be concerned about that. When I think about my birth experience, with my twins and, a woman who might have been having it at that same time who, did not look like me, having a totally different birth experience, and that those babies didn't have the same chance that my babies did. It is as a mother, as a mother, but even more so as a human being, we should not accept that. We should not accept that. So it's important for you to follow and to stay connected to this organization because, again, not only are they providing so many important services that make sense for you if you are one that donates your time or donate your dollars somewhere, this is a great organization to do that to. But if for nothing else, and or additionally, you should be staying connected because of all the great advocacy work that is coming out of this organization. And we will be sharing that through our advocacy efforts too at the YWCA, and partnering more and more. Obviously, we connected early on when you joined your organization, and I was right before your big conference too at the time, and we
Yes,
signed
yes.
on as a sponsor. Our missions are so intertwined and linked on
Mhm.
so many levels, besides the fact that you and I are wired the same way as women and leaders, as well. The work you're doing is so urgent, and in a short time, you've been able to create such great impact with this historic organization, and bring it to present day where it needs to be. And that will only continue if our viewers and our viewers are sharing this with others, to really be able to rally around your work you're doing, no matter whether or not you're someone who could use the services. It's important that we lift this up. So my one question for you is, though, and again, you talked about the great services, the great partnerships, the expanding services,
Mhm.
um, the jarring statistics, I guess, are what I want to go back to for a minute, and link to the advocacy, because at the root, where I think one of the places you and I talked about and want to continue talking about, where we want to make sure that we're continuing to link arms and organizations, is making change,
Mhm.
in that systemic racism area, and how to educate people on the issue, and then how to give people action items,
Mhm.
what to do to make that change, and then how to actually get in there and shift that culture so that it's not the case. But you mentioned it, and we've obviously been supportive and involved. Our first lady, Tammy Murphy, when she came into office along with her husband, she took this on as being,
Mhm.
really, when she started, her primary focus. um, what did that do for your effort? And um, you know what other organizations and entities, how can we all stand up and join, to support that? Because I know that a lot of this is educating people on what they don't
Yes.
know, because if you look like me, your experience is different, so
Mhm.
you may not know that this is even going on unless
Right.
you've been introduced to it in some way.
Right, right. And I think what First Lady Tammy Murphy did with her Nurture New Jersey strategic plan is really shine a light from the aspect of privilege, right? Because we've been working in this space for 30 years. We've been banging the drum saying, hey, this is what's happening. But she said, look at me, look at my experience, just like you said. This cannot be that we're living in such a state, and we're a very wealthy state, right? We're a very
Hmm.
privileged, that half of the people that go into the hospital, they may come out unscathed. Doesn't mean that they were unharmed. Their experience is not the same. How
Yeah.
can that possibly be? How can we be putting half of these people at a detriment, coming home and affecting the entire community? So when a mother, passes away, it's not just her nuclear family, right? She could have been the person in the community that, you know, that does daycare for the other kids. She could have been a mentor. It really reverberates throughout the community and throughout generations. So, working with the Department of Health, working with the New Jersey Healthcare Quality Institute on their maternal action plan, working with different community organizations to ensure that we lift the voice. Because, of course, the old adage, if you educate a man, you educate an individual. If you educate a woman, you educate an entire nation. We
Hmm.
need to be educated. We need to ensure that we can speak up when you go somewhere, when you go to the physician and something doesn't sound right. You can say, I'm sorry, can we go back and can you give me some clarity on this? Why do I need to do this? And why do I need to do that? Or can, we discuss what happened last week. We have to be able to be advocates for ourselves, and we have to know what is happening out there. What are our assemblywomen doing? What are our
Right.
senators doing? How are they bringing legislation forward? What legislation is going forward? How does it impact me? We absolutely must have a voice. And in order to have that voice, we need to be educated. We need to
Yeah.
be educated. So even if it doesn't apply to you, oh, I'm not pregnant, I don't know anybody who's pregnant, we have team programs. We have Top and Prep that help teenagers make educated decisions, right? It's not sex deterrent or pregnancy deterrent. It's educated decisions, because once you educate people, they say, oh, I didn't know that. And we have to realize there's a lot out there that we don't know. But the partnership is here to make those referrals, to ensure that we're working with our community organizations, because that's really important. We don't want to come into a community and say, this is what you need. There are community organizations that we need to partner with to say, hey, what's going on here, boots on the ground? How can I, like you said, link arms with you to ensure that the community is aware, that they are empowered about lead poisoning? We had an instance where we had a Bengali community. They were unaware that there was quite a bit of lead in the makeup, the dye that they were using. They were completely unaware of that. But we would be unable to help them if we didn't link with a community organization,
Yeah.
that specifically speaks to that community. We're a diverse group of people. We're not a melting pot. We're a salad.
Yeah.
And everyone has to keep their individuality while making sure that salad is robust and beautiful. And the only way that we can do that is linking arms together and ensuring that people are educated. So if you come to our website, you can also use pmch.org. We have a plethora of education, not only for professionals, but for the general public. So if there's something that you're interested in, whether it's menopause or postpartum depression, a fatherhood program, parents as teachers, breastfeeding, it's all there for your perusal. So it's again really about making those connections and ensuring that the community is aware of the terrible statistics. Because sometimes
Yeah.
I'll go to community events and we'll talk about the statistics, and they're like, no, yes, this is what's happening. This is what's
Yeah.
happening. And your
And
experience is important to bring that forward.
for sure. And we've had so many women come on YWTV and share stories that were startling, for
Mhm.
someone like me, in comparison to my birth story. So it is so important to listen, to learn, to stay connected to your organization, to really, be educated on the reality and not necessarily what's skewed because of your
Mhm.
privilege, for some of us, or, where we sit in the world, for sure.
Mhm.
And I also want to, and I said this yesterday on our show with the Assemblywomen, and I want to say it again. We are kind of launching into, heavy election season. And November, every year is where we, are focused in getting out our vote. And I say this, and I say this to you from now, even though knowing that we're in July.
Mhm.
You really, for our viewers as voters, need to be aware of, these key issues, and then be looking at the candidates and making sure that the person that you're voting for is representing your
In your
values and
interest, absolutely.
representing what your interests are
Mhm. Mhm.
on these types of issues. And
Mhm.
I also would say to you, is not only your own, personal situation, but thinking about your community, women as a whole.
Right.
Because again, um, you know, just because of my privilege, it is absolutely my responsibility when I'm voting to be thinking about women that don't
The
look like
community at
me,
large.
who do not have my privilege, and be
Absolutely.
voting from a humanity perspective on,
Mhm.
what we want to see as
Mhm.
being, the norm in our
Mhm.
state and in our country, for women, for women's health across the board, that there shouldn't be any racial or gender disparity, connected, or any cultural disparity, to any of these issues, that
Mhm.
across the board, everyone has access, and everyone is heard and, empowered to advocate for themselves individually on issues and collectively. So I'm so grateful. The time goes quick, as I always
It
say,
does, it
when
does.
we get together, which, the good thing is, and I always think my father always used to say this, that means that there needs to be a part two,
Exactly.
of a visit, of a vacation, whatever it is, because it always goes quick, for
Mhm.
sure. And so there will, and obviously for us, because of our like-minded missions, our joint passion in terms of our work, we will be doing this again and again in this and other forums for sure. And I see that we've got Tevra on from New Jersey in Color saying, "Do your research and vote." She
Hey, Tevra.
100% is right. We love Tevra. And Tevra knows this, obviously because of her important work at NJ in Color and what she brings forward in the community. And as a new mom,
Yes.
she has personal experience with this as well. So she gets it. So I want to make sure again for our viewers that you check out the website, you check out the Instagram feed, you stay connected to the organization. Mariekarl, are there any events coming up that we should be thinking about that are on the calendar or that
yes,
we should be looking for?
They're definitely on the calendar. When you go to pmch.org, when you go to the calendar, you'll see there's so many events. August is National Breastfeeding Month. So we do have a breastfeeding series there, which is absolutely excellent. We have some very, very good speakers on there. And while you're there just looking for the calendar for the month, you can look and see what we had last month and the month before. This weekend, we have fellas events. We have some festivals that we're going to be at, but it is definitely all on the website. And it's about getting involved, getting educating, making sure that we're empowering the community to ensure that every family in New Jersey is not only living their best life, but they are thriving and educated. So once we start with the thriving and they're educated, everything else is a no-brainer.
Goes from there. Well, look, folks, we gave you a lot of information. It was so much important information. But again, this is the season. You should be thinking about, who you're putting in office, thinking about these issues. Also staying connected, and we will help connect you to that too with our advocacy alerts that we are, getting ready to launch at the YW about these issues, about bills that you should be thinking about. And I'm also going to say one more thing before we leave each other is we need more women making these laws. We need more women of color sitting in the seats of power making these laws. It was so amazing listening to the Assemblywoman yesterday talk about where her focus has been. And as I said yesterday, and I'll say it again, there's not a lot of white males that have been elected to office sitting there with the same focus that the Assemblywoman has had. And that should concern us. That should concern us. And that we should, this is both sides of the aisle, folks. This is not a party issue. At this point, it's an issue around values. It's an issue about it's about issues, quite frankly. It's not about party. So be thinking about that for yourself, for the women in your circle. Poke people to be thinking about getting into getting appointed onto committees, getting involved in organizations, considering runs as whether it's for local positions, state positions, national positions. We need to change the landscape of who is making 100%. Laws and who is creating policy. And that happens at appointed and elected levels, because that is what, alongside of the great work like the partnership is doing and the YW is doing and other, important advocacy groups and resource groups that are out there, is going to shift the culture to be what we want it to be. So
we need to have those diverse voices at the table. And remember, if there's no chair, you can bring your own.
Absolutely. And let me also say, if you look like me and you have a chair, pull a chair next to you. And that's, I'll bring Mariekarl to the party and others for sure. So listen, folks, as I said, it's Friday. I mean, we left you with, such a great bright light for your weekend. And I'm so grateful that you could be with us, Mariekarl, and that you could, share the important work that you're doing. And we're so grateful and so lucky to have you at the helm of this important organization and helping transform it and expand it, because the work is so urgent. I know that the two of us feel the same way. We would love to be able to say that this work is no longer needed and become yoga teachers or something. Sure. But until then,
carry on.
We are here and we are rooted and we are linked arms.
Thank you so much, Helen, for having me. I look forward to seeing you.
Same. Bye, everybody.
Bye-bye.
Bye, Tevra. Bye, Tevra.